pandemic, local health departments have remained a constant source of information and resources to keep our communities safe and protected. In a special report tonight, KIMT News 3's Jessica Bringy spoke with local departments in Minnesota and Iowa about how they have served us these past 18 months while still trying to navigate the unknowns of this deadly virus.
Whatever you need to make yourself safe and your health to be stable, I feel like they have done a good job in pushing that out to us.
As we near the 2-year mark of when the COVID-19 pandemic began, many are reflecting on the impact local health agencies have had on our communities.
Like they was really trying to help all students, get vaccinated so it'd be less like school missed and stuff.
Since early February of 2020, local departments like Cerro Gordo Public Health and Mason City have been among the community leaders ready to assist in whatever capacity is required.
The pandemic hasn't been a bad thing to bring to light that public health agencies have a critical function and role, especially in our local communities.
Director of CG Public Health, Bryant Haniff, says one of those critical roles stems from the department's ability to collaborate.
How well communities collaborated with their community partners, I think, really is a reflection on the overall ability for a community to kind of bounce back. And we had great partners. We still have great partners. We worked through a lot of difficult situations together. And I think that's been a huge benefit.
The Olmsted County Public Health Department has also been working hard to tailor its response to community needs, including organizing mass vaccination clinics and ensuring accurate information is being communicated to us all as efficiently as possible, all while trying to ensure its own staff isn't suffering from burnout.
It's pretty easy to pay attention to folks' physical well-being in terms of a pandemic or any other types of endeavors, but I think it's the emotional health risks that sometimes are even more significant. So I got to give us a lot of credit for having taken that on and made that a priority to focus on and address that.
Employee well-being professional Alan O'Malley Larson says Olmsted County recognized the reality of the pandemic infiltrating every staff member's personal and professional life, which helped ease some stress and allowed workers to focus on how best to serve the community.
The idea that how we choose to think about circumstances can make a difference, and neither to underreact or to overreact, and to fully appreciate the challenges that we faced, at the same time having a determination to overcome those challenges.
Now both health departments are looking back and reevaluating what staff have learned, how they've grown, and what can be used in the future during a health crisis.
I take it very seriously that we need to develop a really, really quality, robust after-action report. And that documentation is important for that 50 or 100 years from now, because we didn't have that from 1918, the Spanish flu that happened. But for us now, for that next episode that were to happen, it's important that we have something on the shelf that says this is how we dealt with this when this time happened.
I think we've learned a lot about how to literally pivot on a dime and make some adjustments in order to meet whatever the need is in the community. And I believe, or I'm pretty strong in believing, that we will have walked away from this with the confidence that whatever comes our way, we're going to be able to meet that need, and that the community can band together to do that.
An area of improvement recognized by both departments is the sharing of accurate and timely information via social media. Both health agencies say the spread of misinformation remains a concern throughout the pandemic. In Rochester, Jessica Bringy, KIMT News 3.
The health department will also begin refocusing efforts on areas that had to be put on the back burner during the pandemic, such as sharing information on STD transmission, which Cerro Gordo County says has seen a significant increase since the pandemic began.